wash your hands. These were the three simple words that were used to save lives. This advice was given by Ignaz Semmelweis to his colleagues in 1850. Today, we see signs in almost every public restroom saying, "Wash your hands." But this was not the case before him. Imagine your doctor about to do surgery on you or deliver your baby without washing their hands. Gross, right? Before 1847, this is exactly what the doctors did. It was not a requirement to wash their hands because they did not think it would make a difference. Semmelweis had lots of women assigned to his care that were begging to be discharged because they believed that their doctors were the harbingers of death. Dr. Semmelweis was one of the few who was actually smart enough to listen to his patients. Ignaz was born on July 1st, 1818, in Buda, Hungary, making him the fifth child born to Teresa Müller and Joseph Semmelweis. His parents were Jewish immigrants to Hungary from Germany. His father owned a wholesale business for spices and consumer goods, earning them enough money to give all 9 of their children an education. Ignaz was enrolled into primary school at the age of 11. He finished his primary education in 1835 at the Catholic Gymnasium of Buda. He hardly was skilled in his own native language, but received second-level honors at graduation. He then left Buda in 1837 to study law at the University of Vienna in Austria at only 19 years old. A legal degree was preferred by parents for their sons because of all the opportunities it offered in the public life. Semmelweis was curious and went to an anatomy class with another student. He enjoyed it and decided to turn away from his plans and transferred to the University of Pest in Hungary to begin his study in medicine. He ended up returning to the University of Vienna in 1840. Ignaz then received his doctorate of medicine in 1844. His mother died, causing him to miss his graduation ceremony. Semmelweis then completed a master's degree in midwifery and passed the examination in August of 1844. Ignaz was a well-liked young man at the time with middle height, blonde hair, and gray-blue eyes. His colleagues made fun of the Buda Swabian accent he had, but he did not seem to mind their jokes. He was determined thoroughly to understand the diseases in women. In the mid-19th century, about 5 women in 1,000 deliveries died when performed at home. The maternal death rate when performed in even the best hospitals was 20 times greater. The cause of this was childbed fever. Childbed fever is a raging fever caused by an infection after childbirth. Dying from this is miserably painful. Abscesses in the abdomen and chest can lead to the irreversible complication of sepsis and death, all within 24 hours. Although every doctor working with these women were seeing the horrifying effects of this, Semmelweis was the only one who cared enough to go out of his way to find a cure. He went through several periods where he believed the disease was beyond prevention, but he still was determined. Ignaz made small modifications in the technique of delivering children, such as turning the women onto their sides during it and having them carried back to the ward instead of making them walk. He also changed the way drugs were administered and made sure the ventilation in the room was adequate. None of these methods lessened the disease. The death of his mother only a week before he was scheduled to receive his medical degree is thought to be what inspired him to be so driven towards his goal. A professor that Ignaz looked up to, named Jakob Koletzka, died because he was accidentally stabbed by a student's knife, causing him to have a massive infection. In the autopsy of Jakob, Ignaz realized that his infection was very similar to that of childbed fever. He discovered that the transmitting source of the infection was found on the hands of students and attending physicians. Semmelweis insisted that the hands of every medical attendant be washed before they could touch a woman. In In the next few months, the mortality had fallen to only 3%. The first year of this caused the childbed death rate to fall to only 1.2%. Some other physicians said that the only reason the statistics were being improved was because of the newly installed ventilation system. In 1848, Ignaz applied for an extension to continue his work at the Vienna General Hospital, but it was not granted. Semmelweis married in 1857 and had 5 children with his wife Maria Wedenhofer. He wrote several papers and even published a book over his findings in 1861. His mental health was severely impacted and his behavior became erratic. So his wife and colleagues sent him to an insane asylum in 1865. This was thought to be because nobody would accept his theory that he worked his whole life to find. He died after being there for 2 weeks on August 13th. His autopsy reported that he died from blood poisoning in a wound that was caused by the constant beating in the asylum by his keepers. The irony of this is that his autopsy took place at the same place where he made his findings, and his body was shown to be much like that of Jacob's, which helped him make his discovery. Only a few years after his death, physicians in other parts of the world started using his method of hand washing to prevent infection. It was undeniable that his work was valid and made lasting change in how we practice medicine today, making him a hero in the medical field and giving him the title of the Savior of Mothers.